Good morning, all. And this is another one of my series of videos about how the Social Security Administration is screwing certain populations of people out of the financial supports and services they need. I did an initial one on how Social Security Administration is looting the adult autistic population to pay for double and triple pension dippers and for millions of people over the age of 110 to 360 years old. And then I did a related video on how Social Security Administrative Law Judge ALJ Kelly Fitzgerald out of the Jacksonville Social Security OHO office is screwing adults who have a formal autism spectrum disorder diagnosis to try to not give financial supports and services the autistic adult population needs to balance the Social Security's budget, which we as all Americans, we know Social Security is in trouble with its budget and might run out of money by 2033 or so. And so the Social Security Administration in the past, and probably these are holdouts from the Democrats in the Biden administration, and even before that, they look for vulnerable victims, people who have vulnerabilities associated with our disabilities that they think are marks they can pick off in order to not pay what we should be paid in benefits in order to balance their budget. They are shameless. The Social Security Administration and their ALJs are out to balance their failing budget on the backs of women who suffer breast cancer. So every woman in this country who has suffered breast cancer ought to be very concerned about what this Social Security ALJ Kelly Fitzgerald did, because this seems to be the Social Security Administration's policy to screw women who have suffered from breast cancer out of supports and services that we may need. So let me get into it. So, on February 13th, 2005, Social Security ALJ Kelly Fitzgerald out of the Jacksonville, Florida OHO Social Security office rendered this decision. The date of the decision was February 13th, 2025. But I didn't receive this Social Security ALJ decision until February 28th, 2025. This video is about the breast cancer portion of her decision, because this kind of fuck screw job of women who get breast cancer should be the concern of every woman who gets breast cancer in this country, the United States. Because what she did to me, Social Security's ALJs might do to you. So, and that's 1 in 8 women who get breast cancer. So, she wanted to hide something, make sure I didn't get my copy of her decision for half a month. But let's get into this further. First of all, we can notice that her decision is unfavorable. And this Social Security ALJ, Kelly Fitzgerald, signed her name to this decision. She also included her evidence log. In her evidence log, she lists that she has the medical evidence of record from my breast cancer surgeon at the Mayo Clinic, James W. Jacob, MD. She admits there's other Mayo Clinic records. Those Mayo Clinic breast cancer medical records of mine, they include not only my breast biopsy that diagnosed that I had invasive ductal and lobular carcinoma breast cancer, and all the records staging it, Of course, all my radiation records where in June 2023, I had a severe radiation burn across my chest. The claimant underwent a left breast ultrasound in September 2022 that was suspicious for malignancy. Subsequent biopsy, notice she's referring only to one biopsy. There were two biopsies, one of the left breast and one of a lymph node. But she's not even though she has that in her evidence log, she's not mentioning it in her decision. Subsequent biopsy confirmed malignant neoplasm of the left breast, stage 2A. And in February 2023, she underwent a bilateral mastectomy, prophylactic right mastectomy, followed by radiation therapy that was completed in May 2023. She was then managed with medications including Verzenio and letrozole, which she tolerated well. I don't know where this ALJ's getting that from. Notice she's not mentioning that 27 lymph nodes were removed from me. We're not seeing the word lymphedema anywhere in her breast cancer analysis here. That's because she's doing a fuck job on women with breast cancer. Notice here is a biopsy of my lymph node. And it was found malignant. It's a biopsy of an axillary lymph node. The biopsy that was malignant found a cancerous lesion, and this is what its size was. But ALJ Kelly Fitzgerald's breast cancer assessment and analysis in her unfavorable decision doesn't even mention this biopsy. It only mentions the other biopsy of the breast tumor. So ALJ Fitzgerald referred to one biopsy in singular form. That was this biopsy, not to biopsies in plural form. And I've already just shown the lymph node biopsy, but this is a different biopsy. So there's more than one biopsy. And she's not addressing all the different biopsies in her ALJ decision. So here's the breast biopsy of the left breast with ultrasound. Pathology, breast, left, and then locates it, infiltrating mammary carcinoma with ductal and lobular features, malignant. ALJ Kelly Fitzgerald, hiding things and manipulating things and not addressing all of the medical records and the full extent of the breast cancer condition because she's trying to mislead. She doesn't address the MRI of the breasts with contrast. And this was done to find the size of the breast cancer in the left breast as well as look at lymph nodes. So she doesn't mention that the left breast cancerous tumor measured up to 3.8 centimeters and it invaded a 1.1 centimeter area of the underlying pectoralis muscle. And then it notes that left level 1 axillary lymph node has not undergone biopsy but should be considered metastatic. So ALJ Kelly Fitzgerald, who's misleading February 13th, 2025 decision in the breast cancer portion of it with the la-di-da, happy version, isn't assessing the full extent of my breast cancer condition. So she just mentions a double mastectomy. She doesn't mention anything about the lymph nodes. Here is my surgical report that she admits in her evidence log she had by my surgeon, James Jacob. So the surgical report is explaining that the left breast tumor, that on the left side, there was a hard fixed nodular breast mass with skin involvement. And the breast was taken off of the underlying pectoralis muscle, removing the pectoralis fascia en bloc with the specimen. The tumor was fixed in the lower outer quadrant to portion of the pectoralis muscle at its lateral and inferior edge to the serratus. Portion of this muscle was excised en bloc with the mastectomy specimen. Now, it's kind of a no-brainer, you know. If you take out a chunk of a woman's pectoralis muscle, then you're going to have a weakness there. So, but this ALJ, it's like she doesn't even live on this planet. Let's look at what she said. Despite her alleged limitations, February 2023, that's referring to removing the pectoralis muscle in the left breast, the claimant presented with no motor weakness. What? Huh? Really? So she can't understand breast cancer. I mean, you know, all I could say is from my perspective of the kind of things she wrote in my report, you know, like there's really big problems with her comprehension and competency if she can't read those medical records and see that lymph nodes moved, if she can't see that a chunk of the pectoralis muscle was taken, and then she says there's no weakness. What? Huh? Really? Surgical report clearly told ALJ Fitzgerald there was a lymph node dissection. Here is Dr. Jacobs' surgical pathology report, and it tells ALJ Fitzgerald that the breast cancer tumor in the left breast was invading the skeletal muscle. One of the arm lymph nodes that was cancerous measured 1.7 by 1.6 by 1.2 cm. And another lymph node nearby was 2.2 by 1.7 by 1.4 cm. And so these are all the lymph nodes that were being submitted in the pathology report. And in the lymph nodes, 6 of the 25 axillary lymph nodes with metastatic carcinoma extracapsular extension were identified. One arm lymph node was negative for malignancy. So altogether, 27 lymph nodes were removed. Now, why isn't that mentioned at all in ALJ Kelly Fitzgerald's decision? Why? I mean, she can't read. She admits having these medical reports. I sent these medical reports to her. So she's trying to mislead and cherry pick and manipulate her decision in order to exaggerate by minimizing the severity of my disabilities. I mean, that's just unacceptable. But the Social Security Administration obviously doesn't care. She's still sitting there deciding these cases. And let's see what else. The ALJ, Kelly Fitzgerald, then concludes that I've not been under a disability from my birth in April 16th, 1956 through the date of this decision, February 13th, 2025. Okay, now let's get into this. Let's take a deeper dive. Something that Social Security ALJ Kelly Fitzgerald was under a duty to do. She was under a duty to develop the record. She was under a duty to analyze and discuss all of the medical records and all of the disabling conditions and functional limitations. So here she's not even mentioning, she's hiding, just like she hid for half a month that she made this decision. So she was hiding in her decision that I had 27 lymph nodes removed. And I actually had lymphedema treatment because in here I had a lymphedema bypass operation to try to treat the lymphedema. So I had surgery to try to treat the lymphedema. She doesn't even mention that either. So I ran this by ChatGPT. Let's see what ChatGPT said. So here's what I asked ChatGPT. When the ALJ analyzed my breast cancer, she only mentioned the double mastectomy in her decision and not the medical records demonstrating the cancer was in 6 lymph nodes and I had 27 lymph nodes removed. And this is resulting in lymphedema, where photos show my left arm is 2 times the size of my right arm. And she also failed to mention the size of the tumor removed from my left breast and that parts of chest pectoralis muscle had to be cut out and removed, and the skin is now very tight on my left chest, and the lymphedema makes it tighter. And this, when flared up by any physical activity, causes pain and reduced left arm mobility. So ChatGPT 4.5 told me, the omission of critical details regarding your breast cancer treatment and its subsequent complications in ALJ Fitzgerald's analysis raises significant concerns. Number 1, incomplete evaluation of breast cancer severity. The ALJ's focus solely on your double mastectomy overlooks essential aspects of your condition, such as involvement of 6 lymph nodes, the removal of 27 lymph nodes, and substantial tumor size, and the excision of portions of your left pectoralis muscle. These factors are crucial in assessing the severity and potential recurrence of breast cancer. The Social Security Administration's listing 13.10 specifies that breast cancer with regional lymph node involvement or tumors extending to the chest may well meet disability criteria. Well, why was ALJ Kelly Fitzgerald misleading and manipulating the writing and data in her SSA ALJ decision of February 13th, 2025 to omit that? Why doesn't her decision mention 27 lymph nodes removed with cancer found in 6 lymph nodes? And why doesn't her decision even mention Social Security's listing 13.10? Why? She's sitting on lots of people's Social Security claims. I sure hope those people don't find out she did a fuck job, especially if you're a woman with breast cancer. So she doesn't even mention that. She's hiding things. It is an offense against women with breast cancer and all that we go through and we suffer with this disease. But let's continue what ChatGPT had to say. Neglect of lymphedema and its functional implications. The development of lymphedema resulting in your left arm swelling to twice the size of your right is a significant post-treatment complication. This condition can lead to pain, restrict mobility, and functional limitations. The SSA acknowledges that secondary lymphedema following breast cancer treatment can be evaluated under listing 13.10 capital E if it necessitates surgical intervention. Even without surgery, the functional impairments caused by the lymphedema should be thoroughly considered. Okay, I had surgical intervention for the lymphedema, a lymphedema bypass operation, because my surgery report lists 3 different operations: a double mastectomy, a lymph node removal of 27 lymph nodes with cancer found in 6, and a lymphedema bypass operation, surgical intervention for the lymphedema. Why is Social Security ALJ Kelly Fitzgerald hiding this? Well, I got texts and a call from a Florida bar member who was advising her in that office, and this was a male. So what? Now we have Florida bar members advising these ALJs to screw women who get breast cancer? Oh, the Florida bar won't discipline a lawyer like that, don't you know? And this continues. I really feel sorry for anyone having an ALJ hearing in the Jacksonville, Florida OHO Social Security office. I mean, Congress should put, and President Trump and Doge should put that office under investigation and audit. And President Trump needs the power to directly fire Social Security ALJs and not just the Civil Service Board, who pats them on the back because they're their fellow peers. Anyway, let me continue, because I already read what she had to say in her decision about my breast cancer. She's hiding the lymph node biopsy. She's hiding the cancer found in 6 lymph nodes and 27 lymph nodes removed. She's hiding the lymphedema. She's not mentioning the Social Security listing of impairments 13.10 and 13.10 capital E. Why? Her decision actually retaliated against me for asking for autism accommodations. Yeah, she didn't thoroughly consider the lymphedema, because she didn't even mention the word lymphedema at all that I could see. Number 3, impact on residual functional capacity, RFC. The ALJ is required to assess how your impairments affect your ability to perform work-related activities. The pain and reduced mobility in your left arm due to lymphedema can significantly hinder tasks involving lifting, carrying, or repetitive movements. Comprehensive documentation of these limitations is vital for an accurate assessment. Failure to consider combined effects of impairments. An ALJ must evaluate the combined impact of all impairments on an individual's functional capacity. In your case, the interplay between breast cancer treatment, lymphedema, and other conditions like fibromyalgia and ASD should be considered collectively to determine their cumulative effect on your ability to work. And just a side note here, and I'm going to talk about this in a future video, but as to my fibromyalgia, I personally sent and signed for by ALJ Fitzgerald's office a copy of my fibromyalgia diagnosis and treatment in Dr. Jesse Yawn's and Dr. Carlos Garcia's 1995 and 1996 medical reports, and medical reports from community hospital, but mostly fibromyalgia and the treatment were discussed in Dr. Yawn's and Dr. Garcia's reports. So what did the hiding, deceptive Social Security ALJ Kelly Fitzgerald do? Well, her evidence log only shows the community hospital records. She did not apparently put Dr. Yawn's and Dr. Garcia's fibromyalgia diagnosis in her evidence log or in her decision. So then she looked at my breast cancer records from 2023 to pronounce that I do not have fibromyalgia, and she can't find any fibromyalgia diagnosis. Yeah, when you want to manipulate the record and take doctor reports out of the record so that you can cherry pick it and so that you can twist and manipulate and screw a woman with autism and with breast cancer out of financial supports and services she needs. Why? Because Social Security has to balance their budget. Don't you know they're in a lot of financial trouble? So you got to pick the marks. You got to pick the most vulnerable people. So she was doing the screw fuck job, and she was taking medical reports out of her evidence log and manipulating it and everything else. And what else did she manipulate? Oh, well, nowhere in her decision does it mention my Social Security Administration 1996 favorable decision that found me disabled, or my 2010 ALJ Christopher Messina decision that found me disabled. She doesn't even mention those. And she was required to take res judicata of those. And both of those, the first one was granted on the basis of my fibromyalgia, and the second one discussed my fibromyalgia and finding me to be disabled. And let's finish with what ChatGPT had to say. And any ALJ who's female, who seems to have that kind of flippant, dismissive attitude that women who get breast cancer don't suffer, well, she's not suitable to be an ALJ. But here's what ChatGPT ended with. By not addressing these critical aspects, ALJ Fitzgerald's analysis may not fully reflect the extent of your impairments and their impact on your daily functioning and employment capacities. that was number 1, incomplete evaluation of breast cancer severity. Number 2, neglect of lymphedema and its functional limitations, impact on residual functional capacity RFC, and failure to consider combined effects of impairment. So, this is just shocking. It's inexplicable. And for her to say, like a pep rally, you're doing better now and everything's fine, well, that is offensive. And it should be offensive to every woman with breast cancer in this country. It should be offensive to the Florida governor's wife, Casey DeSantis, who had breast cancer. It should be very offensive to every woman in Congress who had breast cancer, like Senator Amy Klobuchar. So I don't know why this is being allowed to happen. These screw jobs of women who get breast cancer. Please give women who get breast cancer a fair Social Security ALJ. Because so Social Security can pay millions of people over the age of 110 to 360 years old money. Social Security Administration is out of control. And I'll be doing future videos on more aspects of ALJ, Kelly Fitzgerald Decision. And so, because this affects anybody who has these kinds of medical conditions. And so look for my future videos. If you liked this video, please hit the subscribe button, ring the bell, and thank you for watching.